I'm Dr. Tom Larkin, and welcome to the Oral Wellness website. I'm very excited about the creation of this educational resource for dentists and consumers because this is changing the conversation about how we approach preventive dentistry. Dentistry has had essentially a one-size-fits-all model. When you go to the dentist or the dental hygienist for a cleaning, you get basically the same treatment regardless of what your condition you present with. We're trying to change that conversation and provide more personalized care. So the physicians, the dentists and physicians who are learning about these new approaches, this is what this website's about, and specifically personalized dental care. So we're going to talk specifically about dental decay risk factors. And these include diet, which is the most obvious, the sugars, the sweets, the sodas, the dental hygiene, the effectiveness you are in keeping your teeth clean. Bacterial load, we're really going to talk a lot about bacteria. This is where the consumers are very lacking in knowledge as far as how bacteria, the germs in your mouth, interact to form dental decay. Dental decay is a disease, okay? A lot of people don't know that. There are some issues with immunity. Some people are more susceptible to decay, and we'll talk about that. We'll also talk about oral pH. And that's your saliva's ability to neutralize acid attacks. That's a really big component in the dental decay risk factors. And then genetics. We talk about some people being more susceptible than others. It's a team approach. Our patients who are going to be under this medical dental model will probably coordinate treatment with your family physician to let them know if we have a significant issue that we're addressing. We communicate with them and tell them what our protocol is and the reasons for that. We will review your medical history, your family history, look at your overall dental condition, and screen for decay-causing bacteria. We also screen for salivary pH, and I'm going to show you how that works. The Carry Screen system is a device that we're going to use that actually evaluates the level of decay-causing bacteria, specifically strep mutans in your mouth. It's a very simple saliva test. It yields a number, and the number is reflective at the level of bacteria that's in your mouth. Very straightforward. We might do a salivary buffer test where we look at your ability for your saliva to handle acid attacks. That's a really, really important component of bacterial infection that needs to be addressed. And traditional radiographs, and then also there may be some laser diagnostics, which is a light instrument that measures decay. All of these are, non-invasive. They don't hurt. It's a painless series of tests. And so let's talk about treatment once we make the assessment. It's a personalized approach, and it's based on the results of your current condition and overall health. And what we call our balance program is where we attack this from two standpoints. One, the decay-causing bacteria, and number two, the saliva environment. Okay, those are the two components that we need to address. And based on your risk assessment, some variation of what we call oral disinfection. All of these protocols that I'm going to talk about in this entire section involve what I'm calling oral disinfection, the use of antiseptics in a variety of techniques to get the bacterial environment in your mouth more in balance, okay? And we treat to therapeutic targets. We have targets that we treat to, levels on the Carry meter, and also with assessment of bacteria for periodontal disease, we measure that if that's the issue. The important thing is that we have therapeutic targets. Treatment also, it's a specific long-term regimen, including product recommendations and proper interval for recare. And what we're talking about there is, what do you use at home to support this? All of these programs are extremely home care intensive, meaning it's a compliance thing. You're going to have to do the bulk of the work. We're going to be the educators and the instructors and initiate the treatment, but you have to support it at home. And then we'll pick an interval for you to come in and get checked and evaluate the results. Product selection, these are the main components of product selections. It needs to be antibacterial, and we'll talk a little bit more about that. Neutralizing the pH. So, we have constant acid challenges in our diet, and you need to address that with some type of bringing the pH back to neutral. Remineralization. If in a very, very early stage where a tooth is beginning to decay, there is the possibility that that enamel that has demineralized can remineralize in its very early stages. And so these products have the ability to actually reverse decay in its earliest stages. And desensitizing, when you have this demineralization, one of the effects is your teeth become sensitive. That can also be reversed. Xerostomia is essentially dry mouth. That's a huge issue today for a lot of patients who are on any number of medications that yield a dry mouth. Dry mouth changes the oral environment drastically. It changes the pH, it changes the bacterial balance, it wreaks havoc in mouths. So we need to address that with the proper product. So home care recommendations include daily biofilm control. Now, I'm using the word biofilm a lot. This is why. I don't want to use plaque anymore, because when people hear plaque, they think about a film on their teeth. What I want you to know is that film is alive. Okay, those are live bacteria on your teeth. So we need a regimen of how you control that on a daily basis. You need a neutralizing regimen, pH neutralizing. Xylitol is outstanding in approaching this. Antimicrobial rinses, a variety of rinses, some prescription, some not. We'll probably talk about using a floss pick, oral irrigation, a water pick, some different things that you may not be familiar with to really enhance this process. These are some of the products there, the Carry-Free System, Floss Pick, Hydrofloss, Therasol. These are some of the products that we use. And your recare visits. Your recare visits to the hygienists are essential to monitor the results and actually check and see how you're doing. Okay? The really ultimate goal of this is to give the patient the confidence to know that they can completely control and potentially eliminate any future dental disease. Eliminate what they currently have and future disease. Okay? This really isn't rocket science. It's a very straightforward science.